Hi, everyone, and welcome to the 12th episode of Vitals and Voices. I'm Lathika, and I'm the founder and host.
And I'm Camden, and I'm the co-host.
And we serve
Serve on the
on the
executive
executive team
team
of Vitals and
Vitals
Voices.
and Voices.
Vitals and Voices is a way to bring together mentors and professionals in the medical field to share their experiences with our audience.
Please welcome our guest, Dr. Neeru.
Nero, thank you so much for being a part of this episode. It means the world that you'll be one of our guests for Vitals and Voices. Feel free to introduce yourself and share a few things about who you are.
Thanks so much, ladies. So my name is Neeru Bakshi. I am a physician, specifically a psychiatrist. A couple of things about me are that I've been practicing, so out of residency for almost 20 years. And I've served in medical leadership at a variety of organizations and have some very specific passions that I think we're going to get into later.
Perfect. So, with the first question, can you tell us a little bit about what inspired you to go into the medical field?
Yeah, sure. So this is probably a bit cliche, but I'm Indian, and this is what we are told by our parents that we are supposed to do. This amongst being engineers. Those are probably like the two most highly prized professions in our culture. And so growing up in America, that was something that my parents pushed. And as I got to sort of grow up and experience volunteering at local hospitals, plus also really being interested in finding a profession which I could be helpful to others, but also utilize some of my strengths in science. I thought, okay, fine, I'll give in to the pressure, and decided to go into medicine.
That's so beautiful to hear.
Yeah, that is so beautiful to hear. And I do get the stereotype of, Indian parents wanting, their
Oh
kids to
yeah,
either be engineers or doctors. So, yeah.
yeah.
So next question. How do you think that practicing in a variety of different care settings can provide you with a new perspective?
Yeah. No, so over the course of my career, I've practiced at high levels of care. So for psychiatry, that includes inpatient and residential treatment, and everything else, from outpatient to sort of intermediate levels like intensive outpatient and partial hospital program. And what I've discovered over that is that we get to see different facets of who people are by seeing them at different points of crisis or stability. So oftentimes at an inpatient or residential level care, you're seeing somebody at a really vulnerable and difficult point in their life. And then to be able to see potentially that same person in an outpatient level of care where they're functioning and they're engaged and they're using really effective coping skills, it's amazing because you get to see sort of all of the different facets, almost like a gem or a diamond. You can see all of the different facets. And that's really, really interesting and intriguing to me.
Alrighty. So, if you ever experience any challenging situations, during those situations, what motivates you to keep on going?
I would say pretty much every day is a challenging situation of some kind, to be really honest. And I think, quite honestly, what keeps me going is the ability to sort of take perspective, right? Like what might be challenging for me might not necessarily be challenging for somebody else. And so what helps me to think about that is sort of this idea of this challenge is something that feels specific to me, but then also is something that is going to be time limited. It's not something that's going to be for forever. And there are ways that we can find solutions or connect to things that are really valuable to us. So, like I was saying earlier, like I wanted to be in a profession in which I could help people. And if I think about that ultimate goal, that helps me to get reconnected to why the work that I'm doing is important. But then there's also the need for me to take breaks and step away from the work because it can be really overwhelming. I think it's a privilege for me to hear people's vulnerable stories every single day, but it can also be a lot. And so it's important for me to find ways to connect with what's important to me in my life outside of medicine to help me keep going.
Yeah, I definitely agree with you. So, what is a medical topic that you're deeply passionate about, and why does this topic matter to you?
So I've actually got two, which I feel really lucky to have. One is the treatment of eating disorders. So I worked specifically in the eating disorder treatment field for about a decade of my career, and I found that eating disorders are deeply misunderstood, deeply stereotyped, in regards to sort of like who's affected or how eating disorders work. And I think that there's a lot of assumptions that we make about eating disorders that are not necessarily based in truth. And so part of why it's a passion topic for me is because I want to correct those misperceptions. I want to educate my fellow providers about what eating disorders actually are and what they actually look like so that we can provide better treatment. And then I'm also really passionate about mental health equity. If we, think about the history of mental health treatment in the United States, just as an example, there are deep roots in racism, and there are ways that we look at diagnoses that really don't capture the individual and sort of make diagnoses based off of one specific group and how certain things affect that group or our research are typically based in one certain group. And so I find it really interesting to sort of push back on some of the assumptions that we have about mental health disorders and how we come to understand them and the ways that our system doesn't necessarily support all of us.
I feel like those are two very important topics, and I love that you have passion for them.
Thanks.
So, moving on, how did you feel presenting at your first national conference about social determinants of health?
It was really super exciting. So this was 2023. And this was the first time that I felt I could sort of use my own voice because I wasn't working for an organization that sort of had to present itself in a certain kind of way. I was just presenting my own thoughts and my own interpretations of the research. And it was really empowering to sort of look out at the audience and have them hear things that maybe they hadn't heard before or hadn't thought about before, and I could almost see like the light bulbs going off above people's heads as they were hearing what I had to say. And to get the feedback afterwards from folks who came up to me and, either thanked me or had further questions or even wanted to push back on some of what I was saying, because I think that's an incredibly important part of this as well, too. Just because I'm saying something doesn't mean you should automatically accept it. I want you to be curious and I want you to do your own reading on it as well. So I feel like I was able to inspire some folks to do that day.
That's wonderful. So the next question is, we would love to hear more about the nonprofit that you lead. Could you tell us a little bit about the mission and the vision itself and what led you towards it?
Yeah, sure. So I'm on the board of Project Heal. And Project Heal is a nonprofit organization that helps to increase equity in eating disorder treatment and also helps to increase access to care. So, as I was talking about earlier, eating disorders, I think, are horribly misunderstood, not just by the medical community, but also then by insurance providers. And it can be really incredibly hard for someone to access quality treatment or get it even covered by their insurance. And a lot of times, people who provide treatment for eating disorders only accept commercial insurance, not public insurance, not even military insurance. And so it can be really hard if you sort of fall outside of one specific, well-resourced category. It can be really hard for folks to get treatment. And what Project Heal also does is provides education to clinicians as well as people in the community about eating disorders and how we see eating disorders across a variety of different populations. And so with Project Heal, I'm so honored to be a member of their board and support their mission. And I think that they are just doing such a phenomenal job to change the conversations that we have about eating disorders.
That's
That's
very
amazing.
inspiring.
So, is there anybody in particular that has specifically inspired your journey in healthcare?
Yes, there is. So when I was in my residency training, which I did part of that at Baylor College of Medicine in Houston, I had an attending physician by the name of Dr. Stacy Micheletto, who unfortunately has passed since I worked with her, but she just was exactly the kind of doctor that I wanted to be. She was kind and caring, but strong and smart. And she made you feel like when you were talking with her that she was fully engaged and present with you. And so I would don't know that I would say I'm exactly like her, but I think her modeling that kind of capacity was something that really inspired me and kind of kept me connected to my own goals and mission.
I am so sorry to hear that, by
Thank
the
you.
way.
Thank you.
So, how do you balance your job as a psychiatrist along with other professional and personal obligations that you might have?
I think one of the things about me is that I feel bored if I'm just doing one thing. And so I oftentimes will need to have a couple of different areas in which I'm engaged to kind of keep me connected and keep me going. And so I do work as a psychiatrist in an outpatient setting currently. And as I mentioned, I'm on the board of Project Heal. And then I also serve as the current president for the Washington State Psychiatric Association, where I'm based. And with all three of those, I feel like I get to use different parts of myself. So with the Washington State Psychiatric Association, I get to use my leadership skills and get to bring people together, hopefully under this, common goal of education, not only for ourselves, but for our communities. And then we get to advocate with our state legislature, which is such a cool experience to go down to the state capitol and talk with lawmakers about what's important for the mental health of Washington state citizens. And with Project Heal, I feel like I get to use my creative side because it is a nonprofit and we do have to raise money. And so I get to think creatively of how do we engage our community and the broader eating disorder and mental health communities in supporting a mission that is so incredibly vital and important. And then as my work as a psychiatrist, I love hearing individual people's stories, right? So having this sort of view into somebody's life and the capacity to hopefully provide care and help really keeps me motivated. And so with all three of those, I feel like really get to use my brain in a variety of different ways. And also, I've learned to say no. I think in the past, I would probably say yes to about five other things as well. And so I really have learned the value of just because I can doesn't mean I should or I have to. And so allowing myself space to say no to opportunities that don't really ignite my passions has been very powerful for me.
I feel like that was a good choice. Like, always like making sure that you follow like what your heart wants, like what you want to be passionate about. So, I've definitely had that happen before too.
Yeah. Yeah.
What do you find most challenging about being a psychiatrist?
Oh, it's interesting because it's kind of a double-edged sword. So what's most challenging is also the most rewarding, because what's most challenging is sitting and listening to people's stories. And what I mean to say is that people hopefully feel like they can be incredibly vulnerable when they speak with me. and talk to me about things that they may have not talked with anybody about previously, even sort of the people that they're closest to in their lives. And so having that privilege is the most rewarding thing. However, what that also does mean is that I need to take my time separate from my work to allow space for those stories to exist, but also not hold them internally and so personally, because I think if I were to hold, all of the stories that I've heard over the last 20 years very, very personally and close to my chest, I think I would be burned out and exhausted by this work. And so I think it is part of what I teach patients, which is sort of a like, how do we hold the things that are important and how do we release the things that we need to, and sort of practicing that for myself as well.
That's wonderful. And I really love that. So, is there any advice that you would like to give to students who are watching this episode that maybe want to pursue medicine in the future?
Yeah, for sure. And, part of what I feel really grateful about in my current role is that I do get to work with people who are in college and wanting to pursue medical school, medical students who are pursuing their residency training, and then residents as well. And so I get to see folks who are in a variety of spaces in this journey. And I think the thing about medicine is that it can sometimes demand perfection. And we then can internalize this belief that in order to be successful, we have to do everything right, get the best grades, get the highest test scores, and not ever have a failure. And I think I would just want folks to like work on dispelling that, because that doesn't make you a great doctor. Being perfect and never failing is unfortunately going to lead you in a direction, I think, of being overly rigid and overly tough on yourself. Whereas in this profession, what we really need are human beings who care not only about their patients, but also care about themselves, and who treat themselves with kindness. And so I think if there's anybody who's thinking about going through this journey, it really is sort of that I don't need to be perfect, but I do need to be kind and gentle with myself.
That's some great advice. I feel like it's definitely needed nowadays because a lot of people think about just becoming doctors for the money rather than all the care that goes into it. So I love
Mhm.
that advice and thank you so much.
Thank you.
Yeah, I definitely agree with Camden as well. I think that every healthcare provider should have that passion and motivation to, get up every day and kind of like love the job or like the job that they're doing so they can better treat their patients.
For
But
sure.
behalf of the whole entire team, we just want to say thank you so much for sharing your story with us and taking us along your journey today.
It is truly so inspiring to hear to hear about the challenges you've overcome, along with the many things you've accomplished.
To everyone tuning in, thank you for joining us on this episode of Battles and Voices. Your support means so much to us and it motivates us to keep going.
If you enjoyed this conversation, be sure to follow, share, and stay tuned for more episodes on Vitals and Voices. We'll see you next time.